Chapter 23 is on disruptive behavior disorders. And disruptive behavior disorders, they're basically a group of disorders that are characterized by persistent patterns of behaviors that's going to involve anger, hostility, and aggression towards people and also towards property as well. So people and or property. Within this category, there's going to be the oppositional defiant disorder, conduct disorder, and intermittent explosive disorder. So the first one we're going to talk about is the oppositional defiant disorder. This is a childhood disorder that is characterized by negative, defiant, disobedient, and often hostile behavior towards adults and authority figures primarily. So these behaviors, they're usually going to begin in the home towards the parents. And their behavior will be more intense at home than at school. And children with ODD, they're going to be often difficult to parent. And the typical reward system that we use for kids, they're not going to work for these children that's been diagnosed with the oppositional defiant disorder. So these children, they're going to have limited abilities to associate the consequences with their behavior, which also correlates that these children are not going to be able to make good decisions. If a child has been diagnosed with ODD prior to adolescence, then they are at an increased risk for developing conduct disorder, which has been called a more severe form of ODD, which we'll talk about here in a minute. Let's see, some medications. No, back here. Okay, so medications. Medications have not been proven to help these children a lot, so responsibilities is really going to fall on the parents. And parents are going to have to be taught to ignore the maladaptive behaviors, which basically means that they're not going to want to give the child the attention that they desire when they do something wrong. So kind of avoid the negatives as much as you can. I mean, we still need to make sure that they're safe and all that, but if they're acting out to get attention, we need to teach the parents, well, that's not how they need to get attention. So try to not provide attention when they produce negative, but to provide positive reinforcement and praises when they do something right. These parents are going to teach them that they're going to have to be very rigid with their consequences and their behaviors, and they're going to have to stick to the limits and the settings at all times. Intermittent explosive disorder, this focuses on a time frame of outbursts. So it involves repeated episodes of impulsive, aggressive, and violent behavior that lasts less than 30 minutes. These outbursts will often come without warning, and the trigger and the outbursts are going to be greatly out of proportion with each other. These patients will feel bad for how they've acted once it's over, but they're not going to be able to prevent the outburst from occurring again. Intermittent explosive disorder is thought to be caused from childhood trauma, neglect, or maltreatment. There have been medications proven to reduce the aggressive impulses and irritability, but they're not going to eliminate the outbursts that they have. Now, conduct disorder, it is characterized by persistent behavior that violates societal norms, rules, laws, and the rights of others. So these children, they're going to show aggression to people and to animals, destruction of property, deceitfulness, theft, and serious violations of rules. They are said to kind of basically be calloused as they don't feel bad for their behavior. These children often at risk for an early onset of sexual behavior, substance abuse, and other reckless or risky behaviors as well. And as many as 30 to 50% of these children diagnosed, they will be diagnosed with antisocial personality disorder as adults. So remember what we talked about with antisocial personality. Antisocial personality cannot be diagnosed until the age of 18 because their personality has not yet fully developed. So our theory thinks that personality develops at age 18, so that's when it can be diagnosed. So conduct disorder as a child, and then 30 to 50% will then be diagnosed with antisocial as an adult as well. There are 3 different categories for conduct disorder. The first one is going to be mild, and this was whenever mild harm to others is caused, such as lying, staying out late without permission. And then there's moderate, which is they cause greater harm to others, such as vandalism, verbally bullying, drinking alcohol, and etc. And then there's the severe form, which is whenever harm is considerable against someone, such as raping, killing, injuring animals, physical fights with other peers. When we treat patients with conduct disorder, early intervention and prevention is most effective treatment, such as teaching patients, these children, social skills, increasing the child's ability to comply with demands from authority figures, helping control with their anger management, and how to conflict resolution, so how to work out their conflict. Therapy for the children and also for parents are good as well. So family therapy is good, and individual therapy. And these patients are going to be at risk for hurting others, so we need to make sure that we keep safety in mind. We need to set limits and be consistent, and also teach parents how to utilize this as well. And our focus will need to be on, like we kind of already talked about, on improving their coping skills and working with their social interventions with others. Make sure you read through these nursing interventions as well.